Hi, I'm Renzo Masiclat. I am a second year Bachelor of Health Sciences and Health and Society student, and this summer I did my research with the Department of Family Medicine under the supervision of Dr. Fariba Agajafari, titled Barriers to Healthcare Access of Filipino Immigrants and Newcomers, a Scoping Review. For context, Filipinos are among the largest and fastest growing migrant populations in the world. In 2019, there were approximately 15 million Filipinos residing overseas. In Canada, there were around 750,000 Filipino immigrants based on the 2021 Canadian census, making Filipinos the third largest migrant population in the country. Now, health outcomes are affected by the barriers, um, healthcare barriers faced by immigrants, and accessing healthcare is one of the challenges that they face in their journey to settlement. Some of the common barriers include language differences, difficulties navigating the healthcare system, as well as economic barriers. Therefore, the goal of the study is to explore the current literature on the barriers faced by Filipino immigrants and newcomers in accessing healthcare. To do this, we searched academic databases for relevant studies and used key terms such as the variations of Filipino immigrants, healthcare access, and barriers to healthcare access. We used Covidence, which is an online software tool used to organize studies for screening and data extraction. The search strategy generated a total of 111 studies from Sinahel, Medline through Ovid, and Google Scholar. Duplicates were identified and removed, and 91 studies were screened for title and abstract, and 21 studies were screened in full text, and 14 studies were included in the review. Now, we use the PCC, or the Population, Concept, and Context Framework in screening the studies generated by the search strategy. For population, this included first-generation Filipino immigrants and newcomers over the age of 18, and as well as subgroups such as women, men, elderly, and families. For concept, these included studies that examine how Filipino immigrants and newcomers access primary healthcare. And for context, these are studies published in English from inception until August 2024, as well as studies published in any country. Now, the barriers to healthcare access faced by Filipino immigrants and newcomers can be categorized into three themes. First is language differences. A lot of Filipinos are not fluent in the language spoken in their host country. Language differences happen to be among the barriers in countries where English is not widely spoken, such as Spain and Japan. There are also countries where Filipinos are unaware of their right to a translator or an interpreter, and this leads to misunderstandings between the patient and the healthcare worker or difficulty expressing their needs to their primary care provider. Next are financial barriers. In countries with no universal healthcare coverage, such as the United States, financial barriers hinder Filipino immigrants and newcomers' access to healthcare. For instance, there are cases where Filipinos do not have insurance coverages at all or not have enough for regular primary care visits. And for overseas Filipino workers or OFWs who send money to their families back home, budget is really tight and therefore affects their ability to access healthcare. Now, cultural differences, cultural beliefs and practices affect Filipinos' access to healthcare, and sometimes the lack of competent or competence from healthcare providers exacerbate this, which further hinders their access to care. Now, in conclusion, this review identified the unique barriers faced by Filipino immigrants and newcomers in accessing healthcare in their host countries. These barriers call for inclusive policies, not just specific to healthcare, but policies that would mitigate such barriers to promote better healthcare access as well as better health outcomes. I would like to acknowledge Dr. Fariba Aghajafari and the Department of Family Medicine for their support throughout this review. These are my references. That is everything. Thank you.